Welcome everybody out to episode 82 of Utah in the Weeds, a podcast about medical cannabis and cannabis culture in Utah. Today's episode is with Cody James, the manager at the Utah Department of Agriculture. He's over the hemp side as well as the medical cannabis side. The Utah Department of Agriculture is one of two laboratories in Utah that are doing the testing for your medical cannabis products, tinctures, flower, concentrates, the Delta 8 controversy that's in the market right now, and they have been dealing with. We talk about that in this podcast. So stay tuned. Enjoy this episode with Cody James. From a housekeeping perspective, I want everybody to know about our patient subsidy program called Uplift. This is a donation matching program where we're taking patients or anyone's donations. You can donate online at utahmarijuana.org/uplift, utahmarijuana.org/uplift. When you donate, your donation is matched by our partners Beehive, Wholesome, Deseret Wellness, and Utah Therapeutic Health Center. So you are maximizing your donation, and all of that money is going towards patient evaluations and getting patients that are terminally ill or low income access to medical cannabis in the program. It's a great, we have a great start. We launched it this week. We've had an enormous amount of support already from patients in our clinics, and we think this is going to help a lot of people. We'll keep you updated on how that program is going throughout the next few weeks and months, but we're very excited about Uplift. Utah in the Weeds, I'm Tim Pickett. I'm your host. You can reach out to us on Discover Marijuana on YouTube, comment on any of those videos with questions, and that's a great way to get a hold of me. Subscribe to Utah in the Weeds on any podcast player that you have access to. Just go ahead and stay up to date. Subscribe on the YouTube channel. Come see us at Utah Therapeutic Health Center, one of our 6 locations from Cedar City to Ogden. And enjoy this conversation with Cody James from the Utah Department of Agriculture. This is Utah in the Weeds. Somebody from the Department of Ag. And you're the guy. And you get a little crap.
We're kind of the underbelly, so to say. We're the guys, the ones who don't get seen a lot. And when I say that, we're not really the public view of the medical cannabis industry in Utah, right? We're kind of on the ground with the producers, and there's a lot of things that kind of do fall onto our lap. But we from our standpoint, being down there in the dirt, we're the ones that are kind of making sure that product is safe, and is going out according to the regulations. And so we're probably not the prettiest group to deal with on ESSA, but we think we're pretty important based that way. So we understand that we may not always get the best or have the best view for things, but it seems to go well anyway. But. So
Cody James, what's your role in the Department of Ag? How did you get here?
It's a great question. So I'm currently the manager of the industrial hemp and medical cannabis program. So overseeing both the Department of Ag's portions of industrial hemp, which includes growers and processors, as well as product and retailers. And then obviously similar to the medical cannabis side, where we're overseeing the growers and processors and the products that's being made there. And we also regulate the labs on that side. Really, I've been with the department for about 16 years, kind of made my name, I guess, within the department, 10, 12 years ago as an inspector/investigator for another division, where I kind of took on some things that no one else wanted to take on. And was able to do a pretty good job out of it, I guess. And so it kind of caught the eye of the bosses, and they wanted to kind of move me up to some other positions where I was running programs or fixing programs, things like that. And it just kind of kept going. And this came up, and there's the opportunity that they needed someone with that type of experience to come in with, at the time, Drew was here with us, and he had a lot of industry knowledge and was getting things running, but they also needed someone to make sure that I guess, knew what the red tape was, the government red tape that needed to happen to make sure we was writing rules, policies, things that way. And so I kind of got put in there to do that. And it's still ongoing work, but that's where we're at. So.
Yeah. From the medical cannabis side, when did that start for the Department of Ag?
I think that there was actually conversations going on as early as 2017. As things started kind of popping up out in the public, and the Prop 2 things even before that. And so I know that and this was before my time in this program, but I know there was a lot of discussions that way. Obviously after Prop 2, and then going to the special session in December of 2018. Yeah, that's when that got put on to the Department of Ag, at least the producer side, and they started down that road, and I came over in about May of 2019. So
when it's the Department of Agriculture is responsible, essentially, this is what I view it as, and tell me if I'm wrong. I view the Department of Agriculture as the people who you've got a licensed grower. You've got to monitor them seed to sale, essentially. That's essentially your job, is the product from the time it goes in the ground to the time it gets sold on the shelf. And then all of this testing stuff, right? I mean, you were the only game in town up until, was it even this year? You're the only lab.
Yeah, we actually, the other lab, we do have two. One is obviously ours, and the other is a third-party independent lab. They have been in just a little bit longer in the year, because we did in the last couple of months do a renewal for their license there. But yeah, overall, you're right. I mean, it's our job, and the way we look at it here is that our job is to make sure that the product that is being shipped to the pharmacies is safe. There's the criteria that was spelled out in statute that talks about that, and really trying to make sure that the medical cannabis product in Utah is as close to following the medical guidelines for any other kind of pharmaceutical product out there. And so that's where the testing and that aspect comes in. And so, like I said, we think that our job is that's the number one priority, is that product that is safe and it's being grown and harvested safely and correctly as best as they can, but mostly safely at the growers. And then as it transfers over, and as you mentioned, we do the seed to sell, but then that the processes and the facility and everything at the processors is safe, and how they're manufacturing the product is safe as well. So, hopefully there's not a lot of concern to have those tests, but then we do make sure that we kind of regulate, I guess, from our side. We don't do the testing in my office, but when a test does fail, we're the ones who have to kind of step in and make sure that it doesn't go to the market until it's been remediated or we can prove that it's safe. And so, as I mentioned, we think for sure that our number one job is to make sure that it's safe product going forward. And that also includes making sure that it's certified agents that are in there doing the job, that the facilities are safe, don't have mice running around, and they're cleaning their equipment when they're supposed to. So kind of all encompassing to make sure that we do get to that point of safe product. So,
is the Department of Ag involved in any other medicine testing, or is cannabis really the only consumer medical product that you guys are involved in testing?
So the Department of Ag does test a lot of different aspects from meat, dairy products. They do some other type of chemical testing. Exactly what else they do and what all that encompasses. So I know they do some antibiotic testing and things like that, but mostly in animals and things. But for the most part, what we do, this type of testing at the Department of Agriculture is just set for cannabis. And then also hemp testing, we do the same type of full panel testing on some of the hemp products that we need to bring in and do some either research or an investigation on. But really the rules were written right close to what other pharmaceutical products are, and that's kind of how they follow it. But as you mentioned, it's all that I'm aware of for sure is medical cannabis on a day-to-day basis.
So talk to me a little bit about safety, because it's been we could spend all day on it, and we can get into all these little nuances of stuff that's come up and all these additives and chemical byproducts and that sort of thing. But does the standards, talking about the standards, do the standards get set by your group, or do the standards get set by the statute, or the standards get set by industry? Who decides how much contamination is allowed, or who decides that stuff?
Yeah, and that's great. So some of the standards that did give the Department of Agricultural rulemaking authority and the statute to come up with those. What we did is really look at pharmaceutical aspects of it. Have also our state chemist, Brandon Forsyth, was actually brought in initially just for cannabis to kind of help us get that aspect of it. So between him and people like Blake, as you mentioned, they talked about where that needs to be. People that have a lot better background in the chemistry aspect of things than I do. But there was a lot of back and forth on exactly, but a lot of it also was based on what pharmacies or what pharmaceutical products need to have as well. And so that's kind of was at least the standpoint, or at least the starting point with it. And there's been a few changes, and also there's been some forced changes based like from COVID, for instance, right? I mean, trying to get supplies a lot of time. And so we try really hard to make sure our labs have all the equipment that they need, but during COVID, sometimes there's pipettes that couldn't come because everybody's using them for testing. There's also the aspect that as we took a look at it, initially, the law and was set up so you had to test medical cannabis at the cultivator and then again at the processor, as final product. And so we was kind of doubling up on tests. And so after talking to industry and looking at it and talking internally, we were able to get the law changed to allow the department really to have a little bit more wiggle room to move tests forward, and mostly based on the cost. I mean, those tests aren't cheap. They're pretty expensive. And so now we allow tests to happen depending on if it's going to be a flower product or if it's going to be extracted product, maybe just once before it gets to the processor, and then only for a couple of tests as final product. So it's not going to have to get the full suite twice in hopes to kind of lower the cost.
Reduce cost and get that throughput a little bit better. Right. And get products to market.
And we felt like through the research that we could still do a good job of making sure that the quality assurance is being met in that way. And so far, I think we have. I think that the testing aspect of it is a success because we have found some issues where we've had to put holds on products, whether it's flower or extracted material, and get with the producer and say, no, you can't move this anymore. How are you going to remediate things like that? And then, and after that, all of them are good. Nobody wants something that's going to make somebody sick getting out to the market. It's in everybody's best interest, obviously, first and foremost, health-wise for the public, but from the business standpoint on their mind. And so, like I said, I think we've ran like close to over 4,000 samples in 2021. Something only like 65 tests have failed. And so those are 65 times that we've had to contact a producer, but all the time we have a system worked out now where they let us know, okay, it's on hold. We want to remediate it this way. We approve it. And then very rarely do we ever see something fail a second time.
Talking about like flower, everybody is fascinated with, and there's been some discussion that you take, the Department of Ag takes so much of our flour for testing, right? We have 50 pounds and they got to take, a whole pound or something like that. It's just such a high amount. Has that changed, or is that true? Is that even true? I mean, do you have to take so much that it decreases like the amount in the market?
I don't think it decreases the amount in the market. I think maybe early on it did, right? That first year when everything was just starting, I think that there wasn't a real lot that was being produced anyway. And so anything you took out the top or took out of any harvest was going to kind of hurt, be felt, when people were only using 800 square feet to grow and just getting started. And especially when the product first, or the industry just first got off the ground and there wasn't really a lot of processors that were doing extracted products. Either it was almost all flower and there was very few of it, right? Why the egg growers got up and running. But now we're seeing, with the amount of grows and both indoor and outdoor, that we're not hearing those same concerns on that. the other thing to keep in mind, and again, this goes back to we've got chemists and people who are involved that deal with that stuff a lot and have a lot more knowledge than I do about it. But there's 7 different tests, right? We're testing not only for cannabinoid profiles, but heavy metals, pesticides, microbials, all kinds of different things that takes a little bit more time, and you have to break them some of it down to test for some of them, and some of the other ones you have to break down a different way. So yeah, I can see that, like, so anytime someone comes in and takes 10 grams of something, it probably seems a lot, especially if you have a lower production side. But on the other side, with some of our growers having 2.5 acres outdoor, or 100,000 square feet that growing that they're harvesting, it's probably not as much.
Right.
It's probably relative, I guess, would be the better way to say it, right?
Yeah. In the beginning, it seemed like that was a complaint that I heard once in a while, from the growers. They're like, the Department of Ag is going to take however much of this. And you're right. At the time, they didn't have as much overall.
Right.
And now I don't ever hear that. I don't ever hear that complaint because, heavens, there's 50,000 pounds of dry, flour hanging somewhere, and they're going to extract it. A little bit of testing material is not that big of a deal. Right. Was there ever a time during COVID that you had, another question we get was there ever a time during COVID now with the supply chain problems that you had to reduce the number of tests for flower products? Specifically, you mentioned the pipettes, because I know on some of the COAs, it was said, well, because of a global shortage of pipettes, we've not done certain testing. Where is that at? That particular piece was kind of surprising to me. And I don't know what products were affected or not affected. What do you think about this? Yeah,
so, and I could talk a little bit about it because, again, it's something that's a lot of times over my head, but they're right. So because we never really stopped doing all the testing, what we did is make it, because we had such a small supply of what we did need, that we would do visual tests for like microbials and things like that, and probably a little bit more than just visual tests, to run the tests they could, and if there was a need to run the full scale based on what they found in those initial tests, they would. But if everything checked out and in the initial test, then they wouldn't necessarily go down any further, just because, like I said, we was running out of ability to run those tests. So we tried to do it on more basis. So what the department had to do, and it took going to, it wasn't just something that was just decided here in my shop or with Dr. Forsyth. It was more, hey, we have to have a meeting with the commissioner, have to get approval from the governor's office and put in an emergency rule to say that you don't have to do this testing all the time for this reason. And that's the reason, because, one of the number one things, as I mentioned, we think the most important thing that we do is make sure that safe product is getting out there. But right close to that, and even more so at the beginning, was making sure that product gets to the patients, right? In order for this program, for this industry to be successful, we've got to make sure they're doing that, that the product's getting to the patients. And so we try to, especially early on, was like, hey, we got to do everything we have to. We got to work as fast as we can. We got to still make sure it's safe, but we also don't want to stand in the way of getting it to the patients. And that still is the same thing here. We want to make sure it gets there. And we didn't want to shut down the entire program because we couldn't get something like pipettes. And as we talked about it, we still had ways that we thought was able to catch any quality assurance concerns if there was any there. And, as I'm not aware of anybody being sick because of quality assurance standard problems.
Yeah, that was going to be my next question, really, is that, are you aware of anybody who's had kind of a negative outcome? And I don't know in my experience with patients, I don't know of anybody with a negative, like, they were admitted to the hospital for some type of infection that potentially would have been caught with that test. There isn't any cases of that out there. Certainly a little bit of, public awareness and transparency. And I think what's important, like, to me, it's nice to hear that it's not just, well, we didn't have these pipettes, so we got approval to not do the tests. Right. It's nice for me to hear, well, we didn't have the pipettes. So what we did was we went to the chemists and we went to our group and we said, hey, how can we keep this safe, but like keep this moving forward right now?
Right.
And that part of it, I think, is a problem for the Department of Agriculture and, frankly, the Department of Health, in that you're doing things on the background that people don't see, right? And it's not like you have this ability to, this marketing team or something, to like push out all this info. Oh yeah, by the way, everybody, we did this instead while we're working through the process, right?
Right.
The other question that comes up with the Department of Agriculture all the time is the testing of, what you do test for and what you don't test for. So many people want you to test for more, right? They want you to test for the entire cannabinoid profile plus the entire terpene profile. Mm-hmm. And we don't do that in Utah, right?
So there was an addition to the statute and for some terpene testing. I'm not sure that we can test for all of it, but what we can test for is the majority of them that they let us know is in there. So we can kind of give some profiles on that type of situation. There's such a number of terpenes and stuff, and trying to find the standards still at the chemistry. And again, these are probably better questions for Dr. Forsyth than myself, but as talking to him about that, because we get those questions as well. Hey, we want to put this on the label. And the requirement is if you're going to put it on the label, then you have to have had to, and talking about terpenes and any cannabinoids, well, it has to be tested for and have that profile or that percentage on there. And that's what we've been asked for. And we've been able to get to that point at our lab and make sure that we're testing for those things that they're telling us about to test for. So, but trying to catch it all on the terpene side, I don't think we're have that ability to just do a broad test and catch every terpene that might possibly be in there.
Right. So, yeah. I mean, there's hundreds and hundreds and terpenes, and I don't know. Will the Department of Ag get out of the testing of cannabis, medical cannabis, eventually? Right. That when there's more labs, you guys get removed.
You're right. Yeah. If we could ever get to 2 labs, then our lab will actually step back and just more take that regulatory aspect where we'll be double checking the other labs on occasion, make sure that it looks like those results are correctly. And then if we have any complaints or investigations where we might need to go, and do some testing, that our lab will do that aspect of it. But until we can get that second lab, our lab's stuck doing a good amount of the sample testing for cannabis right now.
Yeah, I've talked to a couple of other people who run labs, and they've said, wow, the market's just pretty small, and the cost of the investment to create a lab to do this is pretty high. And without one thing is if you're the second lab to come in or you're the first lab to come in, it's one thing. But let's say there's 2 more that come in and now there's 3, is the market big enough to support that? And so far it seems like it's just not that.
Right.
Just not that big.
And we talk to industry about that, especially groups that have kind of have a lot of knowledge about the industry during the last couple of years. And so one of the things that was brought to us was like, maybe if you capped the number of labs as well, that might help, right? To say that you may not have to worry that there's going to be such a small part of the market that so I think we capped it at 4 labs, and hoping that maybe 1 or 2 would still want to jump in there. But yeah, so far I think that the market is still too small for them to want to invest that millions and millions of dollars in the equipment and the building and just do that, just do medical cannabis. So
sure. Okay, so we've got a few questions and I want to get into this. Honestly, we've got to get into this Delta 8 and this thing a little bit, right? Because everybody's going to want to know what Cody James says about the Delta 8 thing. But what do you think we can expect in 2022? And do you think that we're going to get another grow license? I mean, with 9 or something like that. What do you see happening?
So first on the Delta 8 there, and most everybody probably saw the articles a couple months ago about Delta 8 and the concern for safety and things. And we had to have several meetings about that. On the medical cannabis side, we put in place, or the legislature put in place, that there's a need for, if you're going to have Delta 8 or any other THC analogs other than Delta 9 in any products, that it has to meet a purity level of 95%, which, again, this is more chemistry stuff, but in my understanding is that most pharmaceutical side of things, it's a purity of 90%. But we actually increase it up to 95%, and talking to people like Blake, they're happy about that. That's what he tells me all the time. We're glad we know we can meet it. And what that 95% purity means that as you're taking CBD or whatever and converting to Delta 8, sometimes that there's some different things that can be made, some different type of chemical byproducts.
Chemical byproducts, right?
And so that 95% purity test shows that if 95% of the cannabinoids are pure in there, that's the stuff that we recognize, that there's not just some outlier that we don't know what it is, or maybe even scary, sometimes we do know what it is and it's not good, then that passes quality assurance testing on that. And so we feel that the Delta 8 aspect, from everything, and there's going to be tons of research going on for a long time, but we feel like it has a place here. I think that Delta 8 is helping a lot of patients. As I talk to, some of the industry members, such as Blake, such as folks from Standard and a lot of different pharmacies, they're, Delta 8 is popular. And I think as long as we're making sure that it's safe that way, to that 95% purity level, that it has a place in the market and probably should be, along with anything else that starts to come down the line that we'll have to figure out how we deal with as it comes. But
is the Department of Ag, then there's this secondary issue with Delta 8 and Delta 9 products where there's this 0.3%, cap limit, and there's these products that are tested in the medical market. And then there's products that are being sold over the counter that have Delta 8 and Delta 9. Is the Department of Ag supposed to be testing these, or are they coming in from out of state and not getting tested by you, so the purity's different? I guess that's one question. And then another question is, how did we get these 10 milligrams of Delta 9 products on the shelf and have them allowed?
Yeah. So I guess the first part of your question was, how did they get into Utah? Some are out of state, some are in state. There's a couple of manufacturers from in-state that are making those types of products. It was something that we wanted clarification on during the session last year. Didn't necessarily happen, but and again, we tried to figure out what we could, because there is that concern about safety, which, as I mentioned, there was those couple of articles a couple of weeks ago that
a few weeks ago. Yep. And then even the CDC came out and they came out and they're like, we don't deal with anything to do with cannabis except for we're going to tell you that Delta 8's dangerous, or, getting it from a garage chemist is dangerous.
Right. And I think that's where kind of the department is feeling right. We want to make sure that things are safe. On the medical side, we have that control on the QA testing that we do. Like I said, the 95%. We're not quite sure what we're getting on that side, on the industrial hemp side of it, from out of state, from others. Right. We have an ability to go in and test for it, but it's tough for us to get to all those products and test every single one to do that. But so, as talking, the reason why it says that, you could have 10 milligrams there and overall, just put it in a large gummy or something like that, is the way that the statute and the rules written right now. It is all about 0.3% THC by dry weight, right? That's even talk about products, which initially and still is mostly talking about USDA's industrial hemp plant there. And so trying to figure out where the milligrams should be. It sounds like what we're hearing from other states is that other states are kind of starting to make some changes to do milligrams per packaging or per serving size, things like that to kind of do that. So there's kind of I think a federal, I don't want to say federal, but a national effort from different states that are doing things like that we get to be kind of at least participate in and kind of go that way. And because we're always looking to learn something from all these different aspects. And like I said, there's tons of research and trying to find exactly what is the good research versus maybe something that is not so honest and then try and put the best information out there to the decision makers, the lawmakers, and see what they want to do with it. So
because is the Department of Ag kind of stuck in this statute spot where, look, if you meet the requirements, then the Department of Agriculture is basically, you can't deny their ability to put that on the shelf. Is that kind of where you're at? Or do you have to work with the Department of Health to adjust what's allowed? Because it seems to me like, and as the bystander, on the one hand, I'm involved in a medical cannabis advisory group with the pharmacists and a few Q&Ps and some industry people, and on our side, we're saying, look, we don't want patients being able to buy a 10 milligram Delta 9 gummy over the counter in a state where we have really restricted that, right? Like we have, as a state, we've decided that these are dangerous products. They should be allowed only in certain circumstances by certain people. So we believe that. And as a safety thing, we say shouldn't be allowed to buy it at Walgreens. But I also am pragmatic and I understand that, well, if the Department of Agriculture is not like you're tied to the statute and the rule.
Yeah. And we are in a lot of aspects, and this is one of them as well, right? That if you do meet that criteria, then, if the government tells you no and the rules say that all you have to do is meet this criteria and you will get licensed or you will get a product registered, obviously that would put us in a bad situation. It would be illegal for us to deny that. So in a good sense, that is where we are, is that it says 0.3%. There's the argument that USDA's industrial hemp law, the 2018 Farm Bill, allows for you to take CBD and convert it into Delta 8, and that's so because it's coming from CBD, it does that. That's still up in the air. You still have Utah's drug enforcement code that calls all THC analogs other than Delta 9 under the Utah Medical Control Act, that it is illegal type of thing. So it's like stuff we're all dealing with there. And again, it was something that we were trying to get clarification on, and it turned into a lot bigger deal during the session than we thought it was. We knew it was going to be a big deal, but we didn't think it was going to lead to what it led to. And so we're still trying to hopefully, not necessarily pushing that, kind of waiting, like I said, to get other states in input as well. But you mentioned the department, we have reached out to Rich and his side to have him start talking to the Department of Health, get input from them, so we can all be honest. Things like this, we want the state and try and be everybody to be as close to on the same page as we can, because there are two sides to this, and it's a heavy side. But we're definitely wanting to make sure that whatever's out there safe. As I mentioned before, on both sides, industrial hemp and medical cannabis, we feel that our number one job is to make sure what consumers are buying, whether it's the patients or just anybody going to a Walgreens, that it's safe. And then, that public safety in mind too, right? I mean, like you mentioned, if you get a gummy with a pretty high amount of milligrams and then they eat the whole package or something, there's could be some effects that are concerning, right? And all that kind of goes into places we're talking about the public safety, to our bosses here, to the governor's office and legislators. It's stuff that we all want to make sure that we bring as much information to the table, everything really, and let them try and make that decision there after having it. So,
do you feel like that's going to get worked out? I mean, I think that has to get worked out. Like there has to be some more clarity on this.
Yeah,
it just seems like it doesn't make sense otherwise.
I think we're kind of to the point where we're hoping it does as well. Yeah. Right. I mean, everything you said as far as the advisory portion of what you're doing, those are conversations that I know are happening, sure, even at the legislative level. And so I think that I think it'll still be talked about no matter what. And like you said, the hope is that it gets there, because it does put people in at least the department, and really I think the state, in kind of a weird predicament on how you handle a couple things. And it would just always be nice to be kind of all the way in or all the way out on some things. And what does either side of that mean? Is it 0.3 of that, or is it a combination of like a cumulative total? Just some clarification would be nice on our side.
Other than that kind of clarity, does the Department of Agriculture or you personally want to see some type of changes in the medical cannabis program?
No, not really. This year we feel from our side that things are going fairly well, right? I mean, and it's things that are getting better. We're not asking for anybody to do too much on there. There's some clarification, some word changes that were kind of just where they should have used processor versus grower. We're asking for that. There's been some arguments back and forth about sugar on products on the medical side. Oh,
that's right. Yep. Keeping products, because you got to keep the gelatinous cubes separated. And sugar is a very good way to do that. And otherwise, you got to wrap them all in individually wrapped things, or you put them in your car and they all melt together.
Yeah. So things like that on clarification on what.
Oh, what about the drinks? Right? Are you involved in that? Liquid suspension?
Yeah, that's been an interesting one too, because one of the main goals of the legislature and the governor's office is to make sure that this program maintains its medical standing. Right,
Yeah,
that's the goal in Utah for right now, and so there's those type of discussions too that we're looking for clarification on. Because
yeah,
you can take a look at definitions on one side, and maybe a beverage kind of fits into that, and then on the
sure.
other side you look at it and it's like, man, they make great arguments when they're coming to us about this, so it's like, hey, would you at least clarify for us so we can make sure that we're doing it the way that lawmakers intended this to be, type of
Yeah,
thing. Because some of this, I mean, some of it seems, as I first start thinking about a few things, it's kind of a small item. It's like, oh, it's not such a big deal. But as you get going and the conversations get going and back and forth, it's like, man, this might be something that ends up
yeah.
at the legislative, and we hear that all the time too. It's like, well, if you don't do what we think you should, I'm just going to go to my lawmaker, and it's like, you know what? I'm happy to go with you. Let's just clear this up.
Right. Yeah. Let's
That'd be
clarify this
fantastic.
once and for all, right?
Right.
What about home grow? Do you, if that ever happens, I mean, I don't think there's any appetite for that this year, but I think in the long run, trying to project myself in this program down five or more years down the road, it does seem like home grow is always going to come back around. It's always going to come back up for people who want to save money, want to grow. I mean, I grow my own tomatoes. It's very important to me to grow a certain type of tomato every year so I can have sandwiches in July. It's very important to me. And I imagine cannabis would be like that for other people. Does the Department of Agriculture have, I mean, it seems like a lot of work for you if they allow home grow.
Yeah, and to be honest, I don't think we've actually thought that far ahead. It's kind of right now we're dealing with what we have and trying to make sure we have as good a handle on it as there. And as always, anytime that there's a law change or they allow something or take something away, it obviously affects the work that we do. And the legislature usually lets us give some input as like, hey, this seems like maybe what the type of work that's going to cause us, no matter what it is, and we may need more people, or maybe we can not, maybe if they're taking something away, we don't need as many people, and so we can kind of lower our budgets or something like that. But that aspect specifically we haven't really talked about. Like I said, we're trying real hard to just try and make sure we keep up with what's there now.
Right.
And it seems for the first couple of years with law changes, like you mentioned, it took us 6 months to kind of like get out the rules written for each new law change and policies and procedures put in place and doing that. And at the same time, kind of building the team. So that's one of the reasons where we feel pretty happy that we're not asking for like any like wholesale changes on anything.
Mm-hmm.
We're just like, hey, a few kind of clean up things, some clarification, and then let us kind of keep on the way we're going. We'll see what happens, right?
Right.
If there's more changes, but anything like, being able to grow yourselves or in your home is, we haven't thought that far down the road yet. I don't think so.
Right. Is the hemp, kind of switch gears before we wrap this up, really? I mean, is the hemp side really going to take off in Utah? Seems like hemp is, the more you look at this from 30,000 feet, I mean, it seems like medical cannabis is a small part of this much larger thing that's happening with hemp and industrial hemp. What do you see with industrial hemp?
So we're seeing an increase in like processors on industrial hemp. I mean, like that side of things seems to be going, and products keeps increasing, type of thing. What I'm hearing is as kind of the most exciting aspect of the hemp side is the fiber type of thing. There's some people out there doing some really cool stuff, such as making concrete, building houses,
lumber. Mandy Kerr, that Global Hemp Association,
exactly.
She does a great job of kind of exposing us to all of this new stuff.
Yeah, I think that's probably, from at least from my standpoint, from what I'm kind of seeing out there currently, that's probably the most exciting thing for our growers. Have our growers kind of transition maybe over to more of that type of hemp to grow for fiber and things like that. And from everything that I've researched and what you hear from Mandy and others, that we're talking about kind of a whole new world with that type of stuff. And so I think that's the portion that's gonna take off. I think that the market kind of got saturated after the 2018 Farm Bill. Kind of, I think everybody's like, "Hey, I'm going to grow hemp," right? A lot of money, and I think that just kind of collapsed the market type of thing a little there, and we saw that in Utah over the first couple of years. But like I said, talking to Mandy and others, that the more the manufacturing side of it seems to be like something that everybody should get really interested in.
Yeah, and for people who don't know, I mean, when you're growing hemp for fiber, you don't even let it flower.
Right.
Right. So it's not really it doesn't seem like it fits in this, although the Department of Agriculture would be involved in making sure the compliance was there because it's the same gene or genus of plant. It's really a totally different, it's really a totally different process and whole plant thing in there. But I see that piece just growing huge over the next little while and being a big part of, I don't know, this whole idea that cannabis is, is a plant that we can use, right? We can incorporate it back into a lot of other things, not just medicine, but there's a lot of other processes that cannabis is pretty beneficial for. Seems like you guys at the Department of Agriculture are kind of on the tip of the sword, because you're going to have to deal with everything that plant is involved in.
Yeah, it's and sometimes that puts us in a little bit of a difficult situation, because we're trying, again, as I mentioned before, we're trying to just keep up sometimes with what is already kind of come down the road, and so trying to move ahead or think down the road is difficult. But we're also a really small team, right? I mean, I've got almost about to have 6 total people on the medical side, and I'll have 6 total people on the industrial hemp side, and then myself, who kind of splits my time between the two there. And so it's like trying to keep up with all of the stuff that's going on. We're just busy nonstop, and it seems like we spend a lot of time doing that aspect, just the work, rather than being able to kind of sit back and be like, all right, let's really kind of think ahead and some things. Hopefully we can get to that as we build our team and get everybody trained and kind of get a handle on everything that we need to do. And really overall on the medical side, we've seen actually a huge increase in stuff. I mean, because our team was so small, we weren't being able to get out too often, other than maybe going and take samples, or we'd go and do inspections once or every 2 or 3 months. Now we're out there more often, and we're seeing that we're not finding problems anymore, right? We're not finding that things are dirty, or that there's, maybe some product that's not labeled. We're not finding that anymore, which is a good thing. It's compliance is there, so it's kind of more that we can maybe, as I mentioned, start thinking down the road. All right, we've kind of got a little bit of a handle on this. Let's start talking about the stuff there and having those type of meetings with industry as well. So
what else is there? Anything that we haven't talked about so far that you want to bring up? You want to talk about?
I guess I want to probably just say that don't hesitate for anybody to reach out to us, right? I mean, our licensees are pretty good about that. People are trying to get into either side of the industry. They kind of seem to, maybe they look at the website or try to find, or reach out to us. Really happy to talk people through it. Happy to be honest with them and try and walk them down that path, versus, because they're taking a lot of risk just putting any money into it on either side. And so talking to us about it, we can answer a lot of questions. Hemp more on the fiber side. That's something that a lot of people want to do. And as we go and kind of go to some meetings and stuff, there's people like, yeah, I don't think I can do this. And it's like, well, we haven't talked to you. Have we talked before? And they know, and like, well, hey, call us. Let's talk to you, because I don't think that there's as big as roadblock as you think there is for you doing what you want to do, type of thing. And so I think just making sure that people understand that we're approachable, we're busy, but emails or phone calls, we're going to return them. We do a really good job at get back as soon as we can, and usually within the next day. But that's probably the only thing is that.
That info is found on the Department of Agriculture website? Yeah.
You can find at least the industrial hemp side at the ag.utah.gov website. And then that would still get us to the medical cannabis side, but you can go to utahmedicalcannabis.org gov, I think is the other one that, and go to the production side of things, and that'll get you to us as well. So.
Oh, cool. That's great. It's good to know. I mean, I think that's important. I think Utah does a pretty good job of that. I know the Department of Health has done a pretty good job of being available for people, and it's nice to know that's the attitude at the Department of Agriculture for people who want more information, specifically, right? It's important for people to have access to the regulatory bodies, frankly.
Yeah. And we're, like I mentioned, we're so busy just dealing on a day-to-day that we're not always thinking about, hey, we should put something out. You know, we should try and reach out. So really, I guess what I'm saying is that we may not know what the questions are until they're asked, right? And so we're happy to do any research or talk to people and get the answers as best we can for them. We just need to know what the questions are. So
cool. 2 last questions. One, do you have a favorite strain? I asked that to everybody who's who's on the podcast.
No, I'm going to say no. I mean, I'm not going to say I have a favorite strain at all. I don't want to be seen as that I'm picking favorites.
Oh, there you go. Right. So. Right. Okay. Totally fine. And what's Cody James do for fun?
Oh, I've got a couple of hobbies that I try and just kind of get better and better at, kind of live by the idea that you should have a couple of different hobbies, ones that keep you healthy, ones that you have fun with, and some that you kind of make money on. And I haven't figured out that third one yet, but I try and stay healthy and have some fun. And other than that, I just with my family a lot. Pretty much if I'm not at work, I'm doing something with somebody in my family. So
cool. Well, thanks, Cody, for taking time. I mean, it's been fun, been informative. And I'm sure you'll be hearing from some people, maybe from this podcast or me.
Yeah, sounds good.
Absolutely. Thanks, everybody, for listening. This is Utah in the Weeds. You can subscribe to the podcast on any podcast player that you like to listen to podcasts on. If you want to reach out to me or you have questions about this podcast, find it on Discover Marijuana on the YouTube channel and make a comment on the video or make a comment on any of those videos on that channel. We look at all those comments, and that's really the best way to reach out with questions or comments, or if you have anything to say. Thanks again, everybody. Stay safe out there.